position of tension. So in order to create a glide, you have to put slack on one end at a time, not both ends together. You don't want to tension, slack. You want to glide. So you have to pull one way at a time. So put slack on the proximal end, and then put slack on the distal end. Slack on the proximal end, slack on the distal end. That's a median nerve glide.
Even your elbow's good.
Elbow movement creates the largest glide, the largest movement. Okay? Ulnar nerve, this is the position of tension. Side bend away is always proximal tension. So side bend away, smart's a little to go to full range. Put slack on the proximal end, and then slack on the distal end. Slack on the proximal end, slack on the distal end. That's ulnar nerve glide. Radial nerve, which most people don't necessarily even feel the tension on. Wrist and finger flexion, extension. Side bend away is tension, so side bend toward, slack on the proximal end, and then you can do slack on the distal end.
Are you going to tell us slack on the distal end and slack on the proximal?
Well, you need to demonstrate that to your patient. Now, here's the deal. When you demonstrate it to your patient, don't put them in a position of tension, which will aggravate their symptoms. So you want to demonstrate it as a glide. I did that to explain it to you guys. But don't demonstrate the position of tension to your patient, because if they reproduce that, it will aggravate their symptoms.